Please, yeah.
Well, I was going to say one other thing. If you need to write a check, write it to me.
Everyone. My name is Elena Giacomin Dennis, and I have been associated with Shaklee for 35 years now. And the purpose of what we're going to do today is really talk about this idea of our vitamins created equal. And we're going to kind of unfold some things based on a landmark study. And I really want this to be very interactive. I don't want to be a lecturer, so I want you to ask any questions that you might have as this comes up. But that's what we're going to be covering today, and I think you all saw the invitation, so you knew what we were doing. We love hosting these because we love educating. I was a former educator. I actually taught school at McCurdy many years ago with Sharon, and that's how Sharon and I met. And so I guess I've taken my teaching skills and probably have translated it into this business, and I think probably fairly well. But we're going to talk, first of all, about this idea of criteria. Is there a criteria that you need to be aware of when you go shopping for vitamins? Because how many of us in here currently are taking some kind of a multiple vitamin, some kind of a sports drink, something that goes into our body that definitely either promotes health or detracts from our health, even though we think we're doing something good? That's what we really want to discover. So when I was first introduced to Shaklee, I was not an individual who thought I needed anything more than a one-a-day vitamin. And my mother used to send them to me from Wisconsin, and she didn't think that they had them here, I don't know. But she used to send them to me, and I used to take them, and it was something that I never noticed any difference, never felt anything different. Then my dear friend Annie here started talking to my husband at the time and saying, you've been suffering from asthma since you were 2 years old. We probably could help you to reduce your symptoms, and maybe it would even go away. So he, growing up on a dairy farm, working with cattle and cows, knowing that they supplemented those cows all the time, said, maybe I need to listen to this. Well, he comes home and tells me this, and I say, I can't think that that's even going to make a difference. I was very resistant, and I sat there for 6 months watching his health improve before I decided to consider Shaklee. And his health went from being an extreme asthmatic, using an aspirator and inhaler, to virtually being symptom-free, throwing away his aspirator and inhaler, and just really living a high-functioning life without with all the medications and stuff. So that got me on a journey of looking at whether or not there really could be a difference, because I was taking my one a day, didn't really notice a difference. But guess what I wanted to do after the 6 months was up? I wanted to start using these things and figuring out how it would affect me. Now, I was 31 at the time. I had a 3-year-old and a 5-year-old. When they would go down for a nap, I would go down for a nap. But before I went down for the nap, I used to hide peanut M&Ms, the big bags of peanut M&Ms, where everyone else would put their liquor. I would put my peanut M&Ms, and I would snort those babies down. I mean, it would be a quarter of a bag sometimes, a half a bag, and then guess what would happen to me 2 days later? Flat on my back, sicker than a dog, with either a cold or a flu. Now, I'm starting to use these Shaklee supplements, and I'm noticing, number one, I don't need to take a nap with the girls, but I also had no craving for those peanut M&Ms. So that was kind of how my journey started with all this. And I wanted to share that with you because I think it's a really important feature or aspect of looking at supplementation, because now we know for sure, I didn't know back then because there was no proof that vitamins actually worked. It was all anecdotal, right? People's experiences. But today we actually do have proof in a landmark study that was done by the University of Berkeley, California, that Shaklee supplements do make a difference, and we're going to talk about that. And we're going to compare it to a group of people who were using brand X's, whatever those were, to a group of people that were using nothing at all, and then the Shaklee population. So we're going to be discussing that. But what you have in front of you right now is the criteria that I think we all want to start looking at. Did you get that? I did not. Does everybody have one of these? Yes. Okay. Okay, so this is the criteria. There's 5 evaluations that you really want to think about. Number 1, does the company have a reputation for honesty and integrity? Now, when you go to Whole Foods or Trader Joe's or where else do you go? You know, Vitamin Cottage, different places, Sam's Club.
Right there, Joni.
That's all right, Joni, right there. We've got your place. Got you covered. Grocery store, Walgreens. You know, you walk in and you see this myriad of brands, and you know nothing about what? What don't you know anything about?
You don't know about the vitamin. You don't know about the quality or where
the
what's in it.
That's
the
right.
company, right?
That's right.
And you really don't know what contaminants are in there.
Right.
That's right. So you're kind of going in blind, and typically what most people do is they ask the salesperson, you know, what would you recommend? I'm looking for a good multi, or I'm looking for omega-3s, whatever it is, and they say to you what?
This is the one that sells the most.
That's right. This is the one that sells the most. What they don't say to you is, oh, let me tell you about the integrity of this company and the quality of the raw ingredients, right? So I want you to think about that. The next criteria is the product made with high quality ingredients? Number 3, does the product fill a legitimate health need, or is it a current fad? How many of you have seen products that are fads come and go over your adult years? We all have seen
Watch
them.
the Dr. Osh.
Exactly.
No kidding.
So we really want to know that there is a legitimate health reason why you would be taking something. And is there clinical proof that the product actually does work? Now, when you walk into those other stores that we just discussed, there's probably nothing listed on a little, you know, hanger saying, oh, by the way, if you buy this one, you're getting this clinical study and this clinical, right? There isn't. And that's where we're going to differentiate ourselves with Shaklee. And then the last one is the product proven to be safe? Proven to be safe. Now, what does that mean? Oftentimes, companies will say, well, based on a vitamin C study that was done in October, 1950, we know that vitamin C does X, Y, and Z. Well, that's not the kind of study we're talking about. We're talking about, is the study done on this particular product, not using somebody else's evaluation of a study, but on the products themselves. So that's the criteria. How many of you have ever thought about those questions when you went to purchase a product? And that's how we all, and that's how we all really, have been. Now, we might have an exception or two, which is really wonderful. And I think people today are much more savvy than they were in 1979 when I got introduced to Shaklee. People are very savvy about quality of raw ingredients. But we're even going to take it to a whole nother level today, which I think you're going to find very exciting. Now, let's look at a little bit more information here. So now we're going to talk about the Shaklee difference, product testing and the clinical studies that are done on our products. So we have third-party peer reviews that actually do those studies. So one of the things that Shaklee looks at is crop and soil scientists test the earth before they decide what nutrients to apply in order to maximize a crop's growth. Shaklee exclusively tests its food supplements continuously throughout the research development and the manufacturing process for ingredient quality, purity, safety, and maximum bioavailability in the body. Then they publish the clinical trials in peer-reviewed scientific medical journals to prove that the product works to produce better health. So not only do we do all those preliminary tests and studies, but then we turn it over to like Stanford or Harvard or whatever, and then they do a double-blind study on the research that we've done. So which supplements would you rather take? Would you rather take something that is kind of unknown, maybe less expensive, right? Because we know we can go into a mail order catalog and buy 10, buy one and get 10 free or something, crazy like that. So we know you can spend less, but I think what we're going to walk away with today is understanding that quality might equal, a price tag that will create a better value for you right now, but also for the future. So now, let's look at the next page, because this was actually a letter that Dr. Jamie McManus, now she's the chair of medical affairs for the health science and education of Shaklee products, and she gave 10 key steps that Shaklee takes to ensure that their supplements are the best in the marketplace. And before we go over that, many of you may not know how this company Shaklee came about, and so I want to just give you a brief little history before we go over that. In 1915, long before any of us were around, there was a man named Dr. Shaklee who had been very ill as a child, lived in Iowa, and had grown up on a farm where his grandmother and mother were very interested not only in crops but also in herbs. And so he grew up with that. Then he became a chiropractor, and he started using X-ray, the X-ray machine. And he became radiated and ended up having cancer on one side of his body. And they wanted to amputate this one side of his body. He said, no, let me try to heal myself. I think I have enough knowledge based on just growing up. I want to see. So he spent years developing products for himself, eating certain things that when he died at the age of, I think he was 96 years old, he had all of his limbs. So his cancer never, took over his body. So just doing that for himself and being a chiropractor and knowing that he was kind of a visionary and looked at where society was going as far as our food processing. Some people just can see things ahead, and he could see that the Industrial Revolution was going to be taking over, and that we were going to be refining sugar and wheat and all this different stuff, and that our food supply was really going to be changing. So he thought that there probably was going to be a need for supplementation. So he developed the very first multiple vitamin mineral in 1915, a long time ago. 1915, and he was the very first one to coin vitalized mineral. So before that, people didn't know that food had something in it called vitamins and minerals. Now we know that there's phytonutrients in there. We know a lot more because of science. People just knew that they ate food and they got some kind of result. So that's how he actually started. Then in 1956, when he was ready to retire from his chiropractic practice, no one wanted the products to go away, because by that time he was supplying his patients and other healthcare practitioners, and he used the distribution model of word of mouth. And 1956 was the very first network marketing company to ever exist. It was a product of his imagination and his two sons on how this distribution model was going to work. So since 1956, we have actually been clinically testing all of our products exactly the way Dr. Shaklee had done it previously, and we are the only company that has done that kind of extensive research. So now let's read these 10 key things. Number one, Shaklee conducts over 100,000 tests annually to ensure the safety and the efficacy of their products.
Question.
Yes.
What's that word, efficacy?
Oh, very good word. Anybody know efficacy?
The efficiency of?
Yes. Yes.
Effectiveness. There you go.
That's right. It's effectiveness. Yes. Isn't that, it's a great word. A great word.
It actually works.
It actually works. Yep. Each lot of Shaklee products is tested to ensure and guarantee that every ingredient that is listed on the label is present in the appropriate amounts. Now, did you know that sometimes when you are buying vitamins off the shelf, they might have very, very impressive IUs, international units, or milligrams, but they might not have it in the bottle? Did you know that that actually does take place?
They've proven that a lot.
That's right. That's been very highly proven.
And sometimes that's dangerous because it'll say the right amount of vitamin A and it's got an overdose of vitamin A, which is dangerous.
Yes, yes. So we actually, what is in our product is on the label. All ingredients in Shaklee products are qualified under the incredible stringent Shaklee protocol that is very unique in this industry, which tests up to 350 chemical contaminants, including pesticides, herbicides, heavy metals, solvents, and much more. So what does that mean? That means that when raw ingredients come to Shaklee's manufacturing facility, we test the raw ingredients even though they have been brought to us by maybe a certified supplier who says that this stuff is pure. But we test it. And do you know why we test it? Because we have found things like fungicides and herbicides and different lead in ingredients that have been brought to Shaklee that the vendor has said has been pure. So when we do those kinds of tests before the manufacturing, if we find that, we dump it, which just means we refuse it. But guess what? Somebody else comes along and buys it. And I can give you an example. When China had their floods many years ago, I don't know if you guys remember, but it was a big deal. China had major, major floods. And Shaklee was getting their Panax ginseng from China. And the supply came from China after the floods, and Shaklee tested the ginseng, and they found a fungicide in it. So they went back to the supplier, went back to China, and they said, well, of course we had to. You know, there was salmonella, there was E. coli, I mean, it was a mess over there. So of course we had to put that on the plants. We refused it, which meant we were without a ginseng product for over a year. And I would go into Whole Foods, because Whole Foods was still around at that time, or Wild Oats or whatever it was. And I would go in there and I would see ginseng products on the shelf. And I would see ginseng soda on the shelf by Blue Sky and everything. And I knew those products were contaminated, but we lost millions and millions of dollars because we refused to do it. So that's just one example of the kind of a quality control test that we do.